Hello, good afternoon. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to our YouTube Open Clinic. Today is a very important day. Today is important for a very simple reason. We are still alive. We are still counting down to end the year on a very strong note. The topic for today is very important. Now, please, when you come in, let me know your location. So tell me your name and also where you're located and confirm you can hear me clearly so we can start. I hope you can hear me clearly. Can you all hear me clearly? Okay, very good. So we're going to talk about donor eggs, donor sperm, and donor embryo. This is a very important topic. And it's a topic that so many people don't understand. And when you don't understand a concept, you might not really come to terms with that concept. And that might actually be the process that will help you to become a mother or a father. Now, here is the deal. Not every woman will become pregnant and a mother the conventional way. The way God made women and men in regards to bringing forth their own is entirely different. Now, unfortunately, in some situations, you might not be a good candidate to bring forth your own. So there are some medical conditions that might actually predispose you not to be able to use your own eggs to bring forth your own. The same thing is also applicable to men. There are certain medical conditions, there are certain situations that might make the man unable to use his own sperm to bring forth his own generation. Now, when we talk about egg donation, embryo donation, or sperm donation, it's actually a process that can enable the woman, another person, to help you to bring forth your own baby. So in egg donation, the eggs from another woman will be used. So we have to find a good candidate. A good candidate is mainly a younger lady, no medical issues, healthy, very good lifestyle, very good BMI, very young. We don't normally encourage women to go for donor egg from 35 and above. So it's mainly from 35 below. So we're going to get this woman's egg. We're going to place the woman on a couple of treatments. We're going to also place the recipient. So the recipient, let's use, for example, your partner, your female partner is having problems. And for some reasons, she's not able to use her own egg. So there are two people I want you to focus on. The egg donor, who is a lady. A lady, most times we prefer using a complete stranger. You can still use someone you know, but for medical legal reasons and for psychological purposes, it's better you use an unknown donor. There are criteria the donor must meet before the donor can be certified okay. So you focus on the donor, then you focus on the recipient, then you focus on the man. So there are principally three parties in donor egg, donor sperm, and donor embryo. Your wife, yourself, the husband, and the donor. Very important. Now, when we get the eggs from the woman, after we've given her a couple of medications to make sure she's ready, we will prepare your woman to also receive the fertilized egg. So when we are going for egg donor can only be used for IVF. Egg donor can only be used for what? IVF. Now, there are two types of approach. If your woman is okay, if the womb is user-friendly, but the problem is the egg, we can use the donor egg's egg, use your partner's sperm, get both of them together to form an embryo, then transfer it back to your woman. This is your own IVF process. But if for some reason the woman is not able to bring forth her own, we will get the donor egg, we will get your partner's sperm, we'll join them together to form an embryo, then we use another woman who is called a surrogate. These are all possibilities. So there is a major difference between donor eggs and donor sperm. Donor eggs can only be used for IVF process. IVF stands for in vitro fertilization. On the other hand, donor sperm can be used for IUI or IVF. Why do you think donor sperm can be used for both purposes? Because when we are dealing with the egg, we are dealing with the egg independent of the sperm. But in IUI, most people that go for IUI are people that are having male factor infertility. So most couples that will go for IUI are couples that the man is having problem performing his civic duty. So donor sperm can be used for IUI and can also be used for what? IVF. If we are using donor sperm for IUI, we will look for a woman that is actually proven. So your partner will be proven to be ovulating. The criteria for IUI is to make sure that the woman is ovulating and the tubes are open. So these two conditions must be met. So if we are using donor sperm for IUI purposes, our duty is to collect the sperm from a healthy man without any medical condition. A man that lives very good, lifestyle, no problems, then we're going to collect the sperm. When we collect the sperm, we're going to inject the sperm directly into the womb. This is simply what IUI is all about. But we have to confirm that the woman is ovulating. Number one. Now, if we are using the donor sperm for IVF, we will collect the sperm from the man, either use your partner's egg or use a donor egg. Then we join both of them together outside the body of a woman to form an embryo. Then we begin to transfer it back. So this is the major difference between donor egg, donor sperm, and donor embryo. Now, donor embryo can also be used for IVF. So egg and sperm are collectively called gametes. So when we talk about donation, it can be the egg, it can be the sperm, or it can be the embryo. When we are doing this, we are giving the couples an opportunity to become parents. Now, the reason why we use donor egg and one of the cells from the partner is to make sure we have a perpetuity in the genetic link. So if your partner's sperm is going to be used, your partner will still retain his own genetic makeup. If your partner's egg is going to be used, your partner's egg will still be used for genetic component. So let me explain better. We have 3 individuals in the process of donation. So when we talk about the component of that baby, ordinarily, when a woman is coming together with a man to make babies, the woman will come with 23 sets of chromosomes. The man will come with 23 sets of chromosomes. They will combine it to have 46 sets of chromosomes. But right now, we have 3 people involved. So we have the recipient, who is your wife. Then we have the donor, who is a stranger. Then we have you. So the 3 of them will combine to make this baby. If your woman is able to carry the baby, then your woman will be the vehicle that will carry the baby. If your woman is not able to carry the baby, then the surrogate mother will be the vehicle that will carry the baby. So there are 3 factors, there are 3 partners, there are 3 parties when we talk about donor egg or donor sperm or donor embryo. Remember, donor egg can only be used for IVF. There are different types of IVF, but donor sperm can be used for IUI and IVF. Now, donor egg, donor sperm, donor embryo is complicated. It's not a straightforward thing, but it's very, very successful. So there are so many people in our gathering today. Unfortunately, you've done your best. You've spent a lot of money. You've been doing everything you should do. Unfortunately, you are not able to bring forth your own with your own eggs. Donor egg, donor sperm, donor embryo works. So during the donor process, we'll make sure that the recipient, who is the intended mother, is placed on hormone therapy. So your wife will be placed on hormone therapy. The donor person will be placed on, guys, the donor person will also be placed on therapy, hormone therapy. So when we are giving you hormones, there are 2 important hormones we have to focus on: your estrogen and progesterone. So when we give estrogen and progesterone, both to the woman that will give the egg and the woman that will receive, is to make sure that the environment is user-friendly. The idea is to monitor the womb. So anytime we are preparing for IVF or we're going for any fertility treatment, we want to check the thickness of the endometrium. Endometrium is the foundation where the baby will develop. So remember that when fertilization happens in the tube, they will come down to implant in the endometrium. The endometrium is the cover of your womb. So we have to treat the woman who is going to bring the egg. So what we are doing to the woman that will bring the egg is to give her a lot of drugs that will give us a lot of eggs. We normally go for 10 to 15 eggs from the donor in one cycle. So if we have a good candidate who we are hoping to use our eggs for, we target 15 to 10 eggs. Now that 15 to 10 eggs, we're going to go through the process of fertilization. So that 15 to 10 eggs can give us 8 embryos. If we have very good 8 embryos, we can decide to transfer more than one. We can decide to transfer one based on the unique process, based on the unique things we plan to achieve. So some women might be good enough to have twins, to have triplets, to have quadruplets, but it's the fertility specialist that will determine what will be good for you. So this is a simple, straightforward process of going for donor egg and donor sperm. Once we have given the donor lady the drugs that will help her to give us all the eggs she has, once we have given your wife the drugs that will make sure that the cover of her womb is ready, once we have a good sperm from you, then you guys are good to go. So in donor egg, donor sperm, donor embryo, these 3 parties will produce a baby. Now remember, in donor sperm, you can only use it for IUI or IVF. But in donor eggs, you can only use it for what? IVF. Now, what are the criteria? What are those things that will make a couple to actually opt for donor egg or donor sperm or donor embryo? Number 1, unfortunately, some women will have what we call premature ovarian failure. A woman is supposed to still be active, producing her eggs until she goes into menopause. Unfortunately, in some women, they will go into menopause before 40. Any woman that goes into menopause, it means you no longer have eggs. And when you don't have eggs, you can't start your family. You cannot ovulate. So some women can have premature ovarian failure. When you have premature ovarian failure, you don't have eggs. And when you don't have eggs, you cannot ovulate. And when you can't ovulate, there won't be any eggs for the sperm to make. So that's number 1 reason. If your partner has premature ovarian failure, that's a menopause that starts before age 40. How do we know you've gone into menopause? You go to a doctor, we collect your blood sample, then we monitor, we ask you a couple of questions. So if your woman has premature ovarian failure, she will be a candidate for donor egg. Very important. Now, some women, because of age, they might have diminished ovarian reserve. Diminished ovarian reserve means the eggs that God gave you as a woman. Unfortunately, as you're aging, you will be losing them in quality and quantity. When you get to age 35, you will begin to lose a lot of eggs in regards to quantity and quality faster. So some women can have diminished ovarian egg reserve. Let me give you an example. This December, you met your partner, but you're 45. And at 45, it's expected you've lost a lot of eggs. So every month, a woman will lose 1 egg. That's the process of ovulation. If that egg is fertilized, you become pregnant. If the egg is not fertilized, it will pass out as part of your bleeding. But when you get to 45, you've lost a lot of eggs, and the fewer eggs remaining are not of good quality, right? So a woman at 45, if we check the ovarian egg reserve, there are a couple of tests we can do. We can check your FSH, follicular stimulating hormone, or we can check your AMH, anti-Mullerian hormone. These are the 2 hormones that will tell us how much eggs, and of the eggs you have, how much of them are of good quality. So if we confirm you have diminished ovarian reserve, diminished ovarian reserve means you might still have some eggs, but they are diminished. You might be a candidate for donor egg. Now, some men and some women can have genetically mediated disease. So there are some genetic diseases that can run in a woman's family or a man's family, and if she uses her own eggs, that disease can be transferred to the kids. So some women can have some autoimmune diseases, which if we allow the woman to use her own eggs, she will transfer that condition to her generation. So if we discover that, we'll prevent the woman from using her egg, so that disease will not be transferred to the babies. Remember, we are products of our parents. So for example, for me, I look more like my mom's side. Okay. So when my parents came together, my dad brought 23, my mom brought 23 sets of chromosomes. Now, there is something we call the phenotype and the genotype. Phenotype is your outward manifestation. So you can look like your mom, you can look like your dad, you can look like your grandmom, you can look like your auntie, you can look like your uncle. So there is no way like anybody. But what you become is what you get from your two parents. So if you pick up the bad genetic disease as a woman, and we discover that on time, for us to prevent you from transferring it to your kids, we will use donor eggs. So genetically transmitted diseases that can be transferred to your babies can be prevented when we go for donor eggs. Now, if you have had series of failed IVFs, maybe because of your age, like what we advise in our group, once you get to age 40 and you're interested in IVF, we normally advise you to go with donor eggs. So what you have is what you use. If you have a good egg, you have a better chance of having good outcome. Okay? Now, if you have failed severally in the past, consider going for donor eggs. When you're going for donor eggs, it's a very top secret process. The only three people that will know what you do is you, your partner, and your doctor. Not your pastor, not your mom, not your siblings. Look, I'm telling you what to do. I know so many of you are not doing this because of what the community will say, what your mom will say, what your friends will say. If you begin to listen to what the society will say, you're not going to be a mother. You're not going to be a father. So determine to start your family by taking those tough decisions. Infertility is tough. The next phase of becoming a mother is something that nobody can decide for you but you. So don't do it for your mother. Don't do it for your father. Don't do it for your husband. Don't do it for your mom. Do it for yourself. It doesn't matter who feels or whatever. People are going to talk. No matter how good, no matter how bad you are, people are going to talk. So don't, because of what your community, what your society, what your friends will say, and you won't start your own family. So if you happen to be in a position to go for donor eggs, go for donor eggs. Remember, if you have premature ovarian failure, if you have diminished ovarian reserve, if you have some genetic disease, if you've had series of failed IVFs in the past, we recommend you go for donor eggs. Now, the use of donor eggs and donor sperm is very common, and it's very successful. Thank God with modern technology. So there are so many couples that have had donor eggs. There are so many kids you will see out there. You wouldn't even know how they came about. Some of your friends might be, posting their babies' pictures all over the internet. You don't know how they got their babies, but you want to follow that long way. But there are so many ways you can become. Okay, so now I'm going to offer us an opportunity to ask questions. So please ask your questions in real time. This is a live clinic. I'll provide you feedback. So please go ahead and ask your question. In the next 15 minutes, I'll give you feedbacks. Okay? Thank you, Kenneth. Thank you, Omoleye Eunice. So when you join, it's time for questions. So I'm going to sit back. If you have any questions, please go ahead and ask, and I'll give you feedbacks. Okay? And if you know anybody that will benefit from this clinic, please share the links for this teaching with the person. Make sure you subscribe. We normally broadcast on Tuesdays and Saturdays. Today's clinic came a little bit early because we're in a holiday. So I'm using my break time to do this. But Saturdays, 12 p.m. Eastern Time, 6 p.m. Nigerian time. If you go to our YouTube, you will see me discussing a particular topic of great interest. But right now, let's take care of your questions. Please go ahead and ask your questions so I can provide you feedbacks. Ask your questions, please. Do you have any questions? Hello, can you hear me? Please, if you have any questions, go ahead and ask. Okay. So it looks like it's pretty straightforward. I'm not getting any questions. I don't know if it's YouTube, but if you have any question, I'm going to sit back. Okay, I think there's a question that came in. Can you discuss the DNA of a child from donor X? This is a question we usually get. So here's the deal. From current research, we've actually discovered that when a woman is carrying her own baby, whether it's surrogate, whether it's donor egg, whether it's donor sperm, she contributes to the DNA. It might not be big, but she also contributes. So the DNA of the child from donor egg or donor sperm or donor embryo is going to come from the 3 participants. It's expected previously that it's only the donor woman and your partner that will contribute the bulk of the DNA. But we have discovered that the woman that will eventually carry the baby. So let's have a case scenario. Your woman is not able to use her own eggs. You saw a younger donor lady. The DNA of your child will be a combination of the donor lady. The bulk of the donor lady's DNA is going to play a role. So that lady donating her egg will contribute her own DNA. The DNA is going to be based on the genetic component, how she looks, and a lot of things. That's why we take time to go for this. Now, your partner, your male partner will also contribute his own DNA. Then you as the lady will also contribute your own. Though tiny amount of your genetic material will be manifest in the baby, but the 3 parties will play a role in determining the DNA of the child. This is a newer discovery. Previously, we thought it's only the donor and the man that will contribute to the DNA of the child. But we have discovered that the woman that will carry the baby somehow, through nature and nurture, will also contribute to an extent some component of the DNA of the child. Now, before you go for donor egg, donor sperm, and donor embryo, it's important we know the blood group and the genotype of the donor lady. Very, very, very important. Not just for societal importance, but for medical importance. So if your partner, if your male partner is A positive and you are A negative, we want to know. We want to know the blood group of the donor lady, because if your partner is positive and the person that is donating the blood is negative, they can have incompatibility from the second child. So we need to know the blood group of the donor, we need to know the genotype of the donor, and we need to definitely rule out any medical condition in the donor. So the DNA, it's from the donor, your partner, and your wife or your female partner. Okay? All right, let's see. Doc, Merry Christmas. Please, can one use both donor egg and can one use both donor and one's egg together? Yes. We've actually had a couple of our fertility specialists actually go, because let me tell you the truth. When you are looking for a baby, go all out regarding getting a baby legally. So yes, you can use donor egg and you can use your own eggs, both for your own IVF or surrogate IVF. So we've actually had a case of a lady that came to our group. Unfortunately, they were having problems and it took them a long time before the partner got convinced. Guess what happened? They used her eggs and they used the eggs from the donor lady for surrogate, and they ended up having triplets. So yes, we can use the donor egg and we can also use your own egg to go for IVF. But here's what you need to know. At the stage of picking that egg and joining it together with the sperm, once we have an embryo, there is no clear-cut way of knowing exactly which of the eggs that got fertilized. Let me explain again. If we got 15 eggs from a donor and we got 15 eggs from you or fewer eggs, then we got sperm and we cross-matched and we succeeded in having fertilization. Once we achieve embryo level, there is no way to know if it's the donor egg or your own egg that got fertilized. But yes, we can combine both of them. Okay? We've actually also had a situation where the woman will be going through her own IVF and the surrogate woman will be going through her own IVF. We've had a candidate who transferred 2 of her own eggs in her own IVF, then transferred 2 of her own eggs and 2 of the eggs of the surrogate to a surrogate. And the lady succeeded in becoming pregnant, then the surrogate succeeded in becoming pregnant. Both of them had twins. So these are all possibilities. So yes, you can use your own eggs and you can use donor eggs too. Okay? Okay. Please, also the importance of not using fertility treatment like donor sperm, donor egg when one is not psychologically ready. This question is actually the most important question. Now, listen to me carefully. If you do not understand the reason, the rationale, the major role of what you're doing, please don't go for it. If you are not mentally, if you are not psychologically, if you are not fully aware, fully knowledgeable of what is happening, please don't bring forth a baby you can love. Don't have a baby to have a baby's sake. What makes a woman a mother is the heart. What makes a man a father is the heart. It's not DNA. It's not DNA that makes someone a mother. It's not DNA that makes someone a father. There are so many people that are not biological parents, but they are better parents than people that actually give birth to those kids. There are so many of you that are fathers and mothers to your siblings' kids, to your cousins' kids, to strangers' kids. So you don't need a DNA to be, and can I please capture this for me? You don't need a DNA to be a mother. You don't need a DNA to be a father. What you need is a heart filled with love. If you have been too far and wide looking for babies, it doesn't matter whether the DNA is from the woman, it doesn't matter. So please, you have to go for extensive counseling. This is not a walk in the park. It's a complicated process. It's psychologically draining. It's emotionally draining. You have to understand it. You have to understand what you're going into. This is also applicable to people that are planning to adopt. If you know that if you bring forth a baby, there are some people that might actually have maybe one baby or two babies and they want to add to their family. Then you go and adopt a baby. Or you go for surrogacy, or you go for IVF with donor egg and donor sperm, then you begin to segregate, then you begin to ostracize, then you begin to stigmatize in your family. Don't go there. If you are not ready to be a real mother, if you are not ready to love your kids equally, without any prejudice, please stay single. Let me repeat again. If you are not ready to be a mother, if you are not ready to be a father, please don't go for assisted reproductive technique. If your orientation, if your religion, if your culture, if your belief is against becoming a mother, genuinely becoming a father, please do not bring forth babies to hate them. Please do not go for IVF. Please do not go for IUI. Please do not go for surrogacy. Please don't adopt. There is absolutely no way you can ostracize any kid. All kids are equal. All babies are equal, regardless of how you made them. This is the problem we have in our society, especially Nigerians, especially from my tribe. I'm Igbo. We ostracize a lot. We classify a lot. We stratify a lot. I understand that. But you have to come to terms with modern reality. You have to understand that it doesn't matter, because we are talking about joy. Having a baby, having someone call you dad, having someone call you mom is the most beautiful experience in life, and you don't need DNA for that. So if you are not ready, don't even bring forth a baby into this world. I love this question asked by Kenneth. So donor egg, donor sperm, IVF, surrogacy, adoption, it's not for the faint-hearted. It's for matured people. And you don't necessarily need to be old to be matured. You have to go through counseling. You have to accept, you have to love, you have to be involved, because guess what? Whatever your mind thinks, you will become. So if before that baby is conceived and you've already started hating on the baby and you've already started preferring your own biological babies, then you're not ready to be a parent. So don't go there. It would be a sacrilege to bring forth a baby into this world, then abandon that baby. If you are doing that now, right now, repent. Let me talk to you directly. If you adopted a baby, if you fostered a baby, and you brought that baby into your family, then you begin to give your own biological kids undue advantage. You are not worthy to be a mother. You can go to church, you can pray God to forgive you. Once you have decided to bring forth a baby, that baby becomes your child. by all stretch and all imaginations. There should be no discrimination between your biological babies and babies you adopted, IVF, surrogacy, whatever it is. So if you are not ready, please don't go there. You can spend the rest of your life alone. You can die alone. You can do whatever you want to do alone. But please don't go bringing forth babies. Oh, because my mother told me. Oh, because my husband told me. So I just have to do it. No, you can't just go and bring forth babies. Look, don't do it. You have to be ready. So you don't need DNA to be a parent. You need love. Love is what you need. Once you have love, you're good to go. Okay? All right. Do we have any other question? Okay, if we don't have any other question, remember, 31st of December, you don't want to miss this. If you miss this, you will regret it. So go and check your calendar. We'll announce the details. We'll announce the time. We have a big event, our crossover clinic on the 31st. It's going to be a Friday. So we're going to enter 2022 in style. We're going to enter dancing. We're going to enter rejoicing because 2022 is the year of blessing in this group. All the babies you've been seeing in this group are twins, are triplets, are quadruplets. You haven't seen nothing. So come with your dancing shoes. We'll celebrate, we'll thank God, we go crazy. We'll just thank God for life. The most important thing in life is life. So even if you didn't become pregnant in 2021, it's okay. Even if you didn't become a mother in 2021, it's okay. But as you're waking up in 2022, renew your objectives, renew your zeal. Some of you need to just go and find out 2,000 naira and subscribe. So we have a platform. I can meet you halfway. But if you don't come meeting me, how can I help you? Some of you are prayer warriors. But praying alone is not going to make you a mother. If you want, go and live in the church. If you don't meet with your partner, or if you don't go for fertility treatment, you're not going to be a mother. You're not going to be a father. So praying is good. But when you pray alone, you will stay alone. And you might likely die alone. When God is doing his work, God does his work through people. Okay, so show up on the 31st. Be battle ready. We're going to defeat infertility. Okay? So thank you for coming. Remember to subscribe. If today is the first time, subscribe. If you need help, follow up. If your questions are not answered, you can still ask your questions, then I will come back and I'll attend to you. If you need to talk to me, if you need me to consult you, follow the process, subscribe for 1 week, 1 month, 3 months, 6 months. If you are already pregnant, we don't want to hear any stories that touch the heart about our baby. We want all our babies intact. So be careful. We have a special group for pregnant women. So come there, let's fellowship. If you are already in your third trimester, please be careful. If you are in the villages, please be careful. If you are in your third trimester or nearing your EDD, make sure you have a very good hospital you can reference to. Because a pregnancy that started with normal labor can enter theater and end up in CS. We don't want to hear that the woman died. We don't want to hear that the baby died. We want the baby to be alive. We want the woman to be alive. We want the family to be intact. So please be careful. No alcohol, no smoking, no zobo, and no strenuous exercise. Be careful, okay? Pack your bags. If you're in your third trimester, your bag is already packed because your baby can come like a thief in the night. Okay? If we don't have any other question, I'm going to take my exit. But guys, this will be our last clinic for 2021. It's been amazing sharing my knowledge with you guys. You guys have been amazing. You guys have really, really supported me. And I thank you for bringing out your time to attend this clinic today. In 2022, we're going to go extra big. So if you didn't succeed in 2021, it's okay. It's going to happen in 2022. But please, remember to pray. Remember to play 48 hourly. And remember to practice. If you can pray, if you can play, and if you can practice, then motherhood and fatherhood will knock on your door sooner than later. I love you guys. I'll see you guys on the 31st. Until I see you, God bless you and enjoy the rest of your day. Bye-bye for now.